group of the world. Basically, there isn't a group, it's just a piece of people who've got questions about plastic surgery who asked me questions. So I've listed them here, and if you've got any questions, I will be very happy to do my level best to answer them. So do we offer skin treatment for green veins and stretch marks? No, we did have Alok Tiwari, who is a vascular surgeon. This is years ago. Actually, he came to the clinic and was talking about doing, working with varicose veins and doing vein surgery at the clinic, because that would have been quite a good thing to do at the clinic. But it never really happened. So we don't do vein treatments. But I believe Alok Tiwari still works at the Priory, I think. So I would recommend him as a vascular surgeon. So if you have veins, I know it's a kind of a cosmetic problem, but the thing about cosmetic surgery, that there are different types of surgeons who will perhaps do different things, and certainly veins, thread veins and what have you, it would be a vascular surgeon, and Alok Tiwari is a vascular surgeon. But we don't have a vascular surgeon at the clinic at the moment. And stretch marks, no, we don't have any treatments for stretch marks, simply because I don't know of any good treatments for them. I know people do offer treatments for them, but I don't know of any good treatments for them, and therefore it's hard to get behind any treatments for stretch marks. It's a really difficult area which I would love to have an answer for, but I haven't, because it would be great if there was something we could offer for stretch marks. But sadly, I don't know of anything that's particularly effective. It would probably be more of an aesthetic doctor who would probably be involved in that arena anyway. But I don't know of anything, and we don't offer anything at the clinic. So that's so no, don't offer the treatments for those things, I'm afraid. I have sickle cell beta thalassemia trait. Can I get a 360 liposuction with a Brazilian butt lift? Right. Well, so specifically about your sickle cell beta thalassemia trait. That whenever someone has a medical problem, I always say the same thing: talk to the medical doctor who's looking after your sickle cell. And certainly sickle cell trait versus sickle cell disease is better. So sickle cell disease, particularly if you've had some sickle cell crises or had problems with your sickle cell, would be a problem. But sickle cell trait is less of a problem. Nevertheless, we still have to make sure that we optimize your treatment, because we don't want you getting hypoxic or in pain, or these things that can precipitate a sickle cell crisis. So it would involve a history with you. I'm presuming you've never had a sickle cell crisis and never had a problem with it. Most people we tray are asymptomatic. So if you're asymptomatic from it, then we would still talk to your hematologist and what have you. But in a sickle cell trait in itself is not an absolute contraindication. Sickle cell disease might be. So that's the sickle cell part of it. 360 liposuction with a Brazilian butt lift wouldn't do that at the clinic. So if you're asking general, can you get it? Well, you'd have to talk to someone who does it. I don't do that. Quite a big deal if you're talking about 360-degree liposuction. So liposuction all the way around your body and a butt lift. That's quite a big operation. Positioning's an issue. So that's quite a big deal of a procedure. So that you're adding that into the fact that you've got sickle cell trait. So so it's a dubious one. Either way, it wouldn't be me doing it, because I don't do that procedure. So I guess the answer is speak to your surgeon, who would probably liaise with your hematologist. If you don't want to kind of waste, inverted commas, a consultation with your surgeon, because then I would say speak to your hematologist first if you get a chance, and just say, look, I'm thinking of having this procedure. What have you got a view on it? but yeah, it's quite, yeah. So good luck with that one. How long will recovery take from a 3.5-inch tattoo excision on the forearm close to the hand, like on the middle of the arm, front upper side? That's specific, isn't it? Forearm close to the hand, like on the middle of the arm, front. What's front? Is front that or that? Anyway, front upper side. Okay. Well, I guess the answer is the same answer for any kind of surgery, I guess. 3.5 inch. I have a ruler here. 3.5 inches on the arm. So is it 3.5 like that long? 3.5 wide, is it? I always say the thing about a tattoo excision is the main determinant is the kind of diameter in the shortest diameter, if that makes sense. So if it's 3.5 inches long, but only a few millimeters wide, happy days, because it's the few millimeters bit that matters. 3.5, the longest one means the length of the scar. The shortest one means how tight the scar will be. So that's why a round one is bad, because obviously both distances are the same, the width and the height are the same. But if you have a long, thin tattoo, that's fine. But if I have a short, fat tattoo, that's a problem, because it's the distance in the shortest diameter that matters. So 3.5 inches is quite long, but if it's actually quite narrow, then that's less of a problem, because it's the tension that's going to affect the recovery. So if it's really tight, if it's quite wide and really tight, then that's going to make the recovery potentially longer. But essentially, the skin will be healed in about a week, so we usually have a dressing for a week. But as I say, if it is quite tight, you might have little areas which maybe don't heal as well as we like. So a week for the stitch, we usually use dissolvable sutures on the arm, but a week for the skin to heal and the dressing. But it will feel quite tight for a few weeks if you were to do things like lifting. If your job involves lifting, if you do the gym and things, I would say you don't really want to be putting any power through your wrist for about a month, 4 to 6 weeks. So you'll be back to work. If you do an office-based job, you can do that pretty much straight away. It'll feel tight and uncomfortable, but you can get back into normal life pretty much straight away. But nothing like any heavy lifting or, as I say, gym with your upper body and particularly around your wrist for about 4 to 6 weeks. And you'll have quite a red scar there for a few months. Normally say it starts to settle about 3 months, can take 6, 12, 18 months for it to properly settle. So it does take a while for it to settle down. So yeah, so that's kind of recovery right there. Do we offer face and neck lifts? No, we do not. I pretty much specialize in breast and body contouring, which basically means breast and tummy tuck, essentially. Breast, tummy tuck, liposuction, those are the things that I do mostly. Obviously, we do moles, cysts, lumps and bumps. And in fact, just at a meeting today, we're looking at really growing that local anesthetic work that we do. So we're really going to push that. And in terms of the GA procedures, where you get put to sleep, it's just breast and breast, any kind of lifts, reductions, implants, lifts with implants, and tummy tucks and liposuction. But we don't do any face and neck, simply because that's not my special interest in it. So no, we don't offer face lifts or neck lifts, I'm afraid. Kind of specializing in the breast and body. What is the recovery period for unilateral breast reduction? So you know what, it's similar to the wrist, the tattoo on the wrist. Having said that, breast reduction is obviously, or may not be obvious, but it's obviously a bigger operation than a tattoo removal, and there's quite a lot of scarring with a breast reduction. And anytime two scars meet, there's a risk of wound healing issues. So with a breast reduction, you have a scar around the nipple, scar straight down. So where that there's a T junction at the bottom of the nipple, and then there's often a scar in the fold as well. So there's another T junction at the bottom. So there's kind of like two places where there's T-junctions, and so you can have problems with the healing there, particularly the bottom one, the bottom T, that can give you issues with the healing. So again, aim for it to be healed in a week, and usually for pretty much all the operations I do, it's dressings for a week, whatever operation you're having. The bigger operations are just more risk of healing problems, but hopefully you don't get healing problems in any operation, but the risks are greater with the bigger ops. So a unilateral breast reduction is kind of, it's good because it's one side. Obviously, a bilateral breast reduction, you're kind of doubling your risks of complications with that, simply because you're doing both sides. But yeah, wounds heal in a week, and then again, scars red and obvious a few months, and then they settle after a few months. So and in terms of driving, things people often ask about driving, 2 weeks. It depends on how big the reduction is, really. Sometimes people are okay after a week. It's hard to be too kind of like what's the word, like wide about you can drive after 1 week with a breast reduction, because there's breast reductions, so it's kind of depends on the person. So kind of 2 to 3 weeks is normal, but if it's a unilateral and it's just a little balancing one, it might not be too bad. It might be 1 week. So it's hard to know in terms of driving and returning to work. Similarly, it depends on what you do, and if you have to drive to work, then it's going to be that same sort of amount of time before you can drive. So yeah, that's kind of overview, but it would be on a case-by-case basis. So be a bit more specific when we know your exact case. Is it normal for a scar to be ruched up? Good spelling of the word ruched. Is that how you spell ruched? How do you spell ruched? But that is a good spell. I don't know if that's how you spell it, but that looks good. I wouldn't have known how to spell ruched. Up following a tummy tuck, yes. And I'll be honest with you, I probably don't make this clear enough to patients pre-op, because yes, it is the way the tummy tuck is designed. We're always trying to limit the length of the scar, even though it's quite a long scar. Always trying to make it as short as possible. And if you look at it, it's a big one at the top and there's one at the bottom. And if you look at it when you're doing the surgery, there's often a discrepancy of length, in that there's more length at the top than the bottom. So if you just, for instance, started at the middle and worked outwards and just did it exactly as it is, you get massive dog ears. Basically, dog ears are bumps at the end of the scar. And so personally, what I do is I start on the outsides. I don't start in the middle. I start on the outsides to try and make sure there's not a dog ear. So I make sure there's not a dog ear at the ends, and then I work in. But as you start to work in, you're sort of robbing Peter to pay Paul on the outsides, but you've got to pay Paul at some point. So as you get to the middle, you've got to start paying Paul, because you've robbed Peter, or you've robbed Paul. Anyway, you've robbed someone at the outsides, so you've got to start paying back as you get into the middle. And as you get to the middle, you have this big long big distance scar at the top, little distance on the bottom. You think, oh my lord, what I've got to, and you've got to start correcting it in. So what you do is you kind of pie crust it so it looks puckered, basically, or ruched, and you deliberately do that, or I deliberately do that, in order to minimize the length of the scar. If you make the scar longer, you will balance out the discrepancy in length between the top scar and the bottom scar. The longer it is, the more that discrepancy gets less. If you make it like infinitely long, then that discrepancy is less. So shorter scar, bigger discrepancy, and more ruching or puckering of the scar. So it is normal to have a puckered scar. And personally, what I try and do is I try and make the dog ear as small as possible. And I'm okay with having it ruched, because the ruche is the ruche, or the puckers settle. So the ruchedness settles. That's the big point, that the ruchedness does settle. So you're better off giving a shorter scar with ruching, and trying to say to patients, don't worry about the ruching because it will settle, rather than a longer scar. And well, then you're left with a longer scar. So you rather have a short scar and a short-term ruche than a longer scar. So yes, the ruching is normal. Don't worry about the ruching or the puckering, or whatever you want to call it. Pie crust, I don't know if that makes, like a Cornish pasty. It looks like it's not been stitched well, basically. Same with areola reduction, same principle, big circle to small circle. So it's all ruched up, all puckered up, and it looks like it's been stitched badly, but it's just because you've got a size discrepancy, so you have to kind of tailor tack it in, and it looks like that. But that is completely normal. do not panic. It will settle after a few weeks. We'll get you massaging and get you working on it to make sure it settles, which brings me to my next question, which is why is skincare so important following surgery? So yeah, it is important. So in terms of skincare, kind of scar care, if you like. So we talked to you about skin and scar management, and it normally starts at 6 weeks post-op. So that's assuming there's no healing problems. The first 6 weeks is the healing, so we have to get the wounds healed. And usually, in the vast majority of cases, it's dressings for a week and then no dressings. And as I say, the wounds should be healed in a week, but it'll be quite fresh. And so we normally leave it alone for 6 weeks. So you don't do anything for the first 6 weeks. You can wash, shower, get it wet, and all those things, but nothing in terms of managing the scar. After 6 weeks, that's when we start scar management. We will work with you with this, but the majority of cases, it's moisturizer massage is the regime for scar management. Depends on where it is as to how often you can do it. But you know, if you can moisturizer massage to break down that scar tissue, and when we see you at the 6 week mark, often the scars are quite red, they're quite active, they're quite firm, they feel quite firm, and you can tell that there's still quite a lot of activity, quite a lot of scar tissue there. So we get you massaging to help break down that scar tissue. And it does take time, it takes several months for that to happen. And in that time, we always taught you about avoiding sun exposure, because if you get a tan on that scar while it's red and active, it will give you a pigmented scar. You'll end up with a tanned scar. You'll lose the tan the rest of your body, but the scar won't lose the tan if you get a tan on the scar while it's red and active. So you have to be really careful with that skin while it's active and while it's healing. The majority of cases it's moisturizer massage. If they have a problem scar, then you can look at other things. A problem scar being a hypertrophic scar or even a keloid scar, which are kind of raised red scarring. If you have a problem with the scarring, there are other things we can do. Things like silicone, which can come as a gel or a tape, steroid injections. Those are the kind of two mainstays of treating hypertrophic scars. But the majority of the majority of scars do not need that. It's only if you have abnormal scarring. A lot of people talk about steroid or not steroid, silicone for normal scars, and we tend to advise massaging for a normal scar, inverted commas, and it's only really for the red, raised, hypertrophic, overly active scars that we talk about silicone and possibly steroid injection. But you know, we'll talk you through it and we'll work with you through it, because you know, one of the main things I say about the practice is the aftercare is as important as surgery. It really is important to maximize the scarring, get the best scar you possibly can, because obviously that's a huge part of this sort of surgery, because all of the surgery pretty much has got big scarring and kind of often prominent scarring. If you're doing moles, cysts, lumps and bumps are often on the face, because that's where you're going to be more bothered by them, so more likely to have them removed. So we've got to make sure that we make those scars as good as we possibly can. And so post-op scar regime is really important, and I will work with you, Vicky will work with you to guide you with that scar management to make sure it settles satisfactorily. Well, that's it. I am out of questiones. If you have a question, then please feel free to message me on the Facebook, on the Gram, on the YouTube. Are we on YouTube? Hold on a minute. We're on YouTube. Yes, we are on YouTube. You know, I think I'm a bit behind my answers on YouTube. Having said that, I do get quite a lot of questions on YouTube, and I try and keep up with them. But please feel free to message me if you have any questions, and I will do my level best to respond to them. But in the absence of any more questions, I will go and have a lie down, and I suggest you do likewise. And I'll see you safe. Hold on a minute. Wait a minute. It's half term next week, isn't it? Yeah, it's half term. Yeah, we'll see you next week. Week after, I will see you same time, same place, whatever the week after the next week is, assuming the next week is half term, which I'm pretty sure it is. So yeah, see you then. It'll be a rollover week. You heard me, a rollover. So go and put your feet up. I'll see you then. Stop the stream.